We are gathered here today for 3 days. We have just started today and we'll be completing this event on Thursday. The main objective of us meeting at this area is to have our annual learning and reflection meeting.
And also, we also want to see we also want to see innovation. Does the evidence of impact demonstrate innovation in programming? We also want to see the change. Is the change significant? Is it reaching a significant number or not, or just a few? Reliability. Is the evidence of change backed up by sufficient, credible, and timely data and community voices? So presentation becomes very critical. The logic. So those are some of the things we'll also be looking at when we are visiting the different gallery.
Make sure that they hosted. So now they are taking their products to the market so that people can buy and they can generate income out of that. From that income, they can be able to feed their children, they can be able to educate their children, and they can even do some of, and even the savings.
Whereby we support the health facility within our APS that we do together or in collaboration with Christian Health Association and the Ministry of Health.
We have the 3 outcomes. The first one is focused on access. The second one is on quality of education and of teaching and learning. And the third one is on community engagement.
One of the best advocacy and social accountability models that we have adopted and utilized in Lesotho is the Citizen Voice and Action, CVA. CVA is a social accountability model where we build the capacity of the communities so that they are able to hold dialogues with policymakers and lobby for improved service delivery in different sectors.
We engage churches, we partner with churches so that we can address the child well-being outcomes. So, how do we partner with churches? We partner with churches using different models. These are the models that we use. If you can come closer so that you can be able to see. We have channels of hope models. In channels of hope models, we have channels of hope for gender, for child protection, for maternal and newborn child and HIV, and we also have gender.
Where we use the child protection and advocacy model, we have our communities now able, without well-being, to seek birth registration documents from the relevant ministries.
So, in this FY, we were able to reach at least this number of males and females with access to potable water supply. And we are also able to reach this number. Can you see this number? Okay. Of boys and girls from 8 schools with potable water supply.
Strong partnership between the government stakeholders and World Vision. That's amazing experience that I'll take home, where I've seen the principals or the head teachers in schools taking a reading role in explaining World Vision model as their own. Already the issues of sustainability are not questionable there. They're there. However, there are some things, some growth areas for us though to learn from. The issue of integration, where we would preposition one technical program to benefit from another technical program.
The SHIP project particularly impressed me because it built upon the local available skills and resources. So that one stood out for me, and the fact that there is market that is already there for the farmers who are producing wool from that SHIP.
During the field visits, especially for the WASH project, I liked the way the children are involved. They are really participating, they are active, they look empowered. And if we can build up that, especially in our wash infrastructure, in our wash systems, in washing schools, especially for the health clubs, we can go a great mile.
I have learned that if we are still working together with World Vision, there will be good partnership. And this one, we as a stakeholders, it also helps us to work hand in hand so that we should build and help the community there to grow.
In the health program, since I have already said that I am from the health division, I'm very impressed because now we are facing a challenge of maternal death in high rate, neonatal deaths in high rate, as well as under children are dying now. And the most killer is nutrition. So in the health department, they are focusing more on nutrition. And then we have got the community-based structures that we saw when we went to the field that are catering for these children. And here in Lesotho, we are also having a challenge of HIV era or prevalence. So those community groups are also taking care of people who are infected and affected, even the vulnerable children who are there, some of them because of HIV infection in Lesotho.
We have been having quite a healthy relationship with World Vision in the past. We had programs which we went through with, and now here we are with the program on literacy, both in early learning and in primary learning. We are not that much far because we are about a year now in this new program. But yes, so far we have been working well with World Vision, and we are saying, I think so far we haven't had any difficulties with our relationship, and this reflection has helped us a lot in knowing where we should be going towards.